All right, so this is the fourth lecture for this new material. This is going to cover the neurobiology of homeostasis. So this is getting more into the more big picture concepts in neuroscience, moving away from the cellular, simplest or not simple, but like fundamental units of neuroscience, and we're getting more to like how they connect. And you guys have probably all heard of homeostasis, right? Homeostasis is this a desire for our bodies to achieve some kind of balance in our physiological mechanisms. So heart rate, blood pressure, feeding behavior, sleep, wake, anything like that. So the way I define homeostasis is the physiological drive to keep things like heart rate and blood pressure. I'm trying to think of a word for it. The physiological drive to keep values for important body functions within a certain range. I don't know how to spell. Within a certain range. I hope that makes sense the way I said that. But so it's this physiological urge to keep your body within a certain range of all these different types of values. So heart rate, blood pressure, stuff like that. So that picture he showed on the first slide of this lecture, I really like. So it's like a scale, right? And you always want the scale to be balanced. So this is homeostasis, is that you desire the scale to be balanced between sides. So let's say somebody's sitting here and they pull down this side of the scale. What happens is you have a receptor here. So these are your homeostasis receptors. That's just a word I came up with right now. But what they do is that they lead to central integration. So this is higher order brain processing, things, or not higher order, but processing within your brain as opposed to your peripheral nervous system. This sensation of a deviation away from homeostatic balance, so this desire of balance, leads to the activity of things called effector systems. These are really general terms, but basically what an effector system does is it'll then push on this side of the scale to return it to this balance. So what happens is after you get a shift back to balance, thanks to this effector system understanding what happened sensation-wise, integrating that, and then moving the balance back to normal. This is a term I'm going to use a couple times. So effector systems is one you want to pay attention to. And then as we move on, I want to differentiate between somatic motor systems, which are lower motor neurons. These serve as the final common pathway for motion. So everything that produces a motion converges onto the lower motor neuron, which causes muscle contraction, which causes a muscle to move, and your limbs to move accordingly, or your fingers to move accordingly, whatever it might be. These are voluntary. These are things we normally consider movement or motion or motor functions. But we also have the autonomic motor system, more oftenly called just the autonomic nervous system. So the ANS, the autonomic nervous system. So there's technically three branches of this. There's the sympathetic, which we'll talk about in detail, the parasympathetic, and the enteric nervous system, which is important for, a lot of new research is coming out that says that our gut bacteria has a lot to do with mental health. It has a lot to do with homeostasis. And so our enteric nervous system actually has a crucial role in mediating this connection between the gut and the brain. But we're going to focus on the sympathetic and the parasympathetic. So I drew a overview of this in the study guide, so I'm not going to draw that again, just so I have time in this video to do other things. But basically, if I'm going to draw a really simple copy of that, here's your brain, here's your spinal cord. This region of your body, or this region of your spinal cord, is the thoracic, so I'm going to call it T. This is going to be your sympathetic branch of the autonomic nervous system. This region, called the cranio region and the sacro region, these are going to produce the parasympathetic branch, or these are going to give rise to the parasympathetic branch of the autonomic nervous system. So the sympathetic branch, and I don't like to say the sympathetic nervous system because it's the sympathetic branch of the overall autonomic nervous system. Just terminology, but it helps me keep in mind that they're balance each other out. So the sympathetic branch is responsible for what we know of as fight or flight. So this is that, when you feel an adrenaline rush, that's your sympathetic nervous system saying you need energy, you need to do something, a threat is present. So this is your fight or flight. When you're hanging out on the couch watching the new Game of Thrones episode, depending on the episode, it's likely that your parasympathetic is more active. This is that rest and digest. So this is when you're hanging out, not running away from any dangerous predators and anything like that. So you're sitting there, your body's saying, I'm going to use my energy to digest my food. So I'm not going to use a bunch of energy to move around. I'm going to divert it all to digesting food and, maybe even sleeping. You could consider a part of this, producing that sleep-wake cycle. So the specifics of this, I think, are covered a little better in the study guide, especially like the length of the axons. But what I want to emphasize is that for each branch, there's both a preganglionic and a postganglionic neuron. So there's a neuron that extends from the central nervous system, wherever that may be, and this is the preganglionic neuron. It then innervates a ganglion, so something, in the sympathetic nervous system, this would be something like the sympathetic chain ganglion. It's a cluster of neuronal cell bodies that's involved in either the sympathetic or the parasympathetic. And this projects out via the postganglionic neuron, so this is the neuron that's after the ganglion, to the effector organ. So this is the organ, this is the effector organ or system that is designed to understand that there's something going on and shift the balance towards what's most appropriate. For example, if you are on the plains of the Serengeti and you see a lion, your body's not going to say, now's the time to digest food and relax. It's going to say, you need to do something. The balance is not where it needs to be. So it's going to shift the balance toward the sympathetic nervous system as opposed to the parasympathetic. But one thing that's really, really important that you keep in mind is that it's always about balance. And if anyone ever tells you when you're running away from a lion, your sympathetic nervous system is on and your parasympathetic is off, that's a lie. That's not true because your parasympathetic has to always be on. It's more about the fact that your sympathetic is taking over, right? So it's more active, it's more salient and important in that specific case, but your parasympathetic still exists. It's still firing at a relatively lower rate, but it's firing nonetheless. So if anyone ever tells you that, one of your branches of your autonomic nervous system turns off, that's just not true. But, so basically, where was I going with that? So essentially, your sympathetic and your parasympathetic, they kind of go back and forth, and they determine where your body needs to be in any given moment. So what is responsible for controlling this? So if this is your autonomic nervous system, your hypothalamus, and we'll get back to that in a sec, but your hypothalamus Your amygdala can cause changes, which makes sense because, if you see a cheetah, the first thing, or a lion, the first thing might be fear, and that information could travel through the amygdala to the autonomic nervous system to cause these changes. Things like cortical regions, yada, yada, yada. Cortical regions, conscious intervention could also lead to different activations of the autonomic nervous system. And before I go too far into the hypothalamus, because the hypothalamus is considered the most important of these. It's considered the master regulator of the autonomic nervous system. But before I go too far into it, I want to mention that anxiety, and I'll talk about anxiety in the next video with emotion, but anxiety they hypothesize that what it is it's the fact that we don't experience like serious threats to our life enough in modern culture, right? Because, I would challenge you to think of the last time you had to run away from a lion. So what they think is that because your autonomic nervous system isn't getting this input, similar to Charles-Bonnet syndrome in which your visual system wasn't getting enough input, your autonomic nervous system or your amygdala says, hey, what's going on here? I need some activation. I need to do something. Otherwise, I feel useless. Obviously, I'm anthropomorphizing. But what you get is your amygdala and your autonomic nervous system kind of change, or they shift in what they consider a threat. So what happens is, if you're having to run away from lions in the Serengeti, that is the biggest threat in your life. But if you don't, it has to have something to respond to. It has to define a threatening stimuli. So a lot of times it'll lead to things like social avoidance. You don't like social situations because there's fear of failure, or there's fear of missing out or anything, and it causes things like anxiety. So it causes your sympathetic nervous system to say, this must be what's threatening my survival. Is this because it doesn't know anything else that's threatening your survival. And it thinks that something must be threatening your survival at any given moment, because throughout the course of evolution, that's almost always been the case, right? I don't think there's been many organisms that have lived a life of comfort that humans live. So that's just interesting to me that our autonomic nervous system, or our amygdala, is saying, hey, our sympathetic nervous system is saying, something's going on. There has to be something threatening our life at any given moment. But to zoom in on the hypothalamus, after a little tangent, because it's the master regulator of the autonomic nervous system, we give it this designation, and Dr. Myers likes to say the 5, as opposed to 4, F's of the hypothalamus. One thing I totally forgot to mention is that the adrenaline rush you feel is the sympathetic nervous system dumping adrenaline into your bloodstream via the adrenal medulla. And that's covered in my study guide pretty well. But, so the 5, going back, just keep jumping around, the 5 F's of the hypothalamus. So these are 5 functions of the hypothalamus that are used to regulate the autonomic in a certain homeostatic range. These 5 F's are feeding, fighting, fleeing, and I like to say hugging, and freezing is what I think he said in class, although what he means by this is temperature regulation. Temperature regulation. So it's important to keep in mind that this is the function of the hypothalamus. It mobilizes resources to meet these goals. So if you don't have enough food in your stomach, increase feeding. If there's a threat, you could increase fighting behaviors. You could mobilize energy to muscles like your arms and your legs to cause you to fight. You can also mobilize energy to your legs so you can flee away, or whatever may be the case for the 4th F of the hypothalamus. But basically that's what we want you guys to know, is that the hypothalamus is responsible for driving these systems for homeostasis. Thanks.